Hi everybody, Kasey D'Amato here, President of Certified PA Consulting. I hope you're doing well this week. On this week's town hall video, I wanted to talk about the topic of, is it common or appropriate, or is it considered necessary for a PA to see their collection reports? So this comes up all the time with our private clients that we're working with. A lot of people are paid on productivity in certain specialties, particularly dermatology, which is where I started, where I come from. It's very common to have a bonus structure or be paid on productivity only. So in that case, if your bonus structure or your salary alone is productivity only, yes, it is appropriate to see your collection reports, but not anybody else's. It is not necessary to see your colleagues, to see anything else about the practice, but it is necessary to see your own collection reports. And you should have access to those on a fairly regular basis, whether that's monthly or at the longest quarterly. If you are paid bonus or if your whole salary is productivity. If you're paid salary, it's sort of a gray zone. Do you need to see your collection reports? Probably not. If you're paid hourly or salary, it's probably not that relevant, although it is a good learning tool. It is interesting. If you're in an academic center or things like that, it's probably not as relevant. But if you are in private practice, then it can be an interesting learning tool to understand the business of medicine, to understand how things are reimbursed, to understand how long it takes for the payments to come in, to understand when things are denied, when they're denied, when they have to be resubmitted. It is interesting, and I do believe that it can make you more efficient, still appropriate, treating patients and giving the best, absolute best quality of care. For sure, that's most important, but I do believe that it is interesting to understand the numbers behind everything and to understand how the insurance works, particularly if you are paid a bonus on collections. Now, if you're paid with RVUs, it's a little bit different, but you still should be seeing an RVU report. For those who don't know what RVUs are, that's relative value units. It's common in hospital systems. It's a tool used to kind of move money around because the hospital can assign a certain procedure or diagnosis a certain value that might be different to what the reimbursement is, what the insurance companies value that to be. So it allows the hospital systems to reimburse the provider who's spending a lot of time, like a hospitalist or internist or something, that's spending a lot of time with a patient, but maybe there's not a lot of procedures. And typically procedures are higher reimbursed, as we know. Let's say ortho or things like that. Some of those procedures are highly reimbursed, but they don't always take that much time. Let's be honest, right? And we can spend a lot more time with a really ill patient, and there's not a lot of procedures, so there's not a lot of reimbursement. So RVUs allow hospital systems to assign values. Sometimes it's based on time or complexity, but they can take all the money that comes in, pool it, and then they can reallocate it. It doesn't really get paid out or bonused out exactly to the dollar equation. It gets paid or bonused out based on their relative value units, if that makes sense. But you should see the report in that case if you're paid on relative value units. So the couple things to remember is that it is definitely typical and expected to see reports, RVUs, or collections if your salary or bonus is paid based on collection reports or RVUs. If you don't have access to reports and you're curious, don't panic. You can look things up and do napkin math. You can look up the reimbursements for your common codes and you can do napkin math and you can estimate your collections. So you can get a ballpark idea probably within about 15 or 20%. It's not perfect, but you can get a rough idea of what your collections are if you're really curious and you're somebody who's business-minded and number-minded and you're curious and you want to know what you're billing out. You can look it up. You can look up the Medicare reimbursement rates. It's public. And you can find out that information. So it is interesting. And it's also interesting to monitor like seasonality, especially if you live in parts of the country where there's an influx of people seasonally, like Florida or Arizona, is where we see the kind of those snowbirds and people flocking to the warm weather in the winter times. It's interesting to monitor numbers in different seasons or back to school time or beginning of the year when deductibles haven't been met. So lots to think about with collection reports. If you're confused about all this or you want to transition to a collection-based bonus structure or salary structure and you're not sure how, you can contact us, certifiedpaconsulting.com. We can help you through that. We have lots of other videos on our website and lots of resources. And we also offer private coaching as well as courses free webinars, all sorts of tools. And we're here for you if you need some help along the way. Myself, my partner, we're PAs. We're also business owners. We're expert negotiators. We've managed multi-million dollar businesses. We've sold businesses, and we can help you through this process. So we look forward to working with you, and I'll see you on our next town hall video.